Today's webinar is called From Risk to Resilience, Advancing Sustainable Supply Chains in Healthcare. Uh, my name is Erica, and I'm the CEO at Kimball Sustainable Healthcare, and I will be your moderator for today's conversation. As folks continue to join here, we'll just start chatting a bit. One, we're glad you're here. Today's session brings together national policy insights as well as real world healthcare experience to really explore how hospital supply chains can adapt, lead, and build resilience. Now, before we dive in, a few housekeeping notes. The first is that this session is being recorded and we will share the link with registrants afterwards. Um, the second is just that everyone is muted automatically, but please feel free to use the chat to connect, to share reactions, as well as to submit questions throughout. Lastly, we will have time for Q&A at the end, so drop your questions in the chat at any time. I'm going to give it one more minute here, and then we'll get started and introduce our speakers. All right. Joining us today are two folks that I am quite pleased to be sharing a conversation with. I'm going to bring up the slide here and go ahead and get started. Let's see. Slideshow play from the start. Okay. Can everyone see my slides okay? Excellent. All right. So joining us today are two real leading voices in the circular economy as solutions for the healthcare sector. I'm happy to be joined today by Dan Vukolich, who is the president of the Association of Medical Device Reprocessors, and really one of the nation's leading voices on medical device reprocessing. Dan brings more than 2 decades of experience shaping policy and regulatory strategy in the US and globally to advance sustainability and the circular economy for healthcare. Joining us as well is Dr. Paige Fox, and we're thrilled to welcome Dr. Fox, who is the Associate Professor of Surgery at Stanford Medicine and the Medical Director of Sustainability at Stanford Healthcare. Paige is also a nationally recognized leader in reconstructive surgery and sustainability. Dr. Fox is here sharing how she's driving efforts to green the OR, conserve healthcare resources, and improve patient care through innovations in clinical practice, research, and health system operations. We are pleased to have this conversation today really on how circular economy practices are building resilience in a new environment in the healthcare sector. So before we get to our speakers, I'd like to introduce you to KSH. Kimball Sustainable Healthcare is a sustainability consultancy for healthcare providers, healthcare organizations, and we really leverage our expertise across a range of specialties, everything from strategic planning to engagement, program development, policy and standards, as well as metrics. Most importantly, within the context of today's webinar, KSH are industry connectors. We're change management specialists, and we understand really the ecosystems, best practices, and relationships needed to make really good ideas successful at scale. And so KSH is proud to be part of the coalitions really leading sustainability across the healthcare sector. And we are pleased to bring folks like you today together in meaningful conversations to really advance best practices in sustainability. Today's topic is resilience in the healthcare sector through circular economy solutions. And up on this slide really are some fresh statistics from a recent study in the healthcare sector, really on the continuation of expected supply chain disruptions, about looming cost impacts from tariffs and other supply shortages, and really the impacts on the healthcare sector at large. Zooming in, if any of the folks on the call are in the healthcare sector, are providing patient care or providing supplies to those patients, we're living this reality, and we have been for many years now. Just this year, if you were a clinician in the healthcare sector, you may have been faced with a decision of deciding whether or not your patient actually needs that IV solution drip during a procedure. Uh, Really a decision nobody really wants to have to make as clinical protocols are changing on the fly. If you are in the supply chain side of the sector, you either are the person or you know the person whose job it is right now to track the looming cost changes from a really volatile supply chain cost structure as tariffs shift day by day. Those are soft costs. It's time spent, and it's really time that you don't get back in your healthcare system. Now, zooming out across the healthcare system, really, what is the underlying driver of these healthcare supply shortages? We're really in a new environment, and really at the root cause of this, the healthcare sector, much like most sectors, across the globe, we're really working from a material balance sheet that just simply doesn't exist. If we want to continue to provide reliable, cost-effective quality care, we really do have an urgent need to optimize the amount of resources that we're using for the amount of care that is delivered. Now, the good news is that there are solutions already underway, and those are solutions that we are interested in fostering and building across the healthcare sector. What that looks like is creating real, industry level solutions really geared at circular economy practices, sustainable procurement, and industry transformation. Again, right sizing the resources that we're using at the sector level. KSH really works across the continuum of these solutions, both really, fostering those industry level changes, also creating the possibility and the space for these solutions inside of individual institutions through policies and standards that really institutionalize sustainable procurement and best practices. Importantly, we also work with clients to build those operational practices, both clinical practices, new protocols, and just operational standards to make sure that it's easy to successfully maximize the useful life of materials, really making sure that the good stuff doesn't go into the garbage by mistake. Now, what do those solutions look like? I think that probably everyone is familiar with the hierarchy of waste reduction. Of course, this is what it looks like inside of the healthcare sector. And really, those upstream solutions, those things at the top of the upside down triangle, those are really the solutions that we're going to be talking about today. Now, our panelists are really going to expand on what it looks like to redesign, to reprocess, to reuse, and also to avoid unnecessary supply waste. And so I look forward to hearing about those solutions from this team. The thing that I really want to kind of focus on here before we hand it over to our speakers is what a resilient supply chain looks like and what the benefits of that resiliency are inside of the healthcare sector. Again, there are lost costs that we will never be able to measure, that we will never be able to recover. Really, chasing a supply chain that is beset by ongoing disruptions, it's expensive on a lot of different levels. And so circular economy practices not only create a more materially efficient supply chain, it also builds operational, clinical, administrative efficiency inside of our healthcare systems. Those costs, again, are real dollar savings that lower the cost of healthcare, something that the healthcare system in the US has been challenged with for years. Very importantly, the last thing that I want to say is that resilience expands not only from healthcare systems, the industry at large. What we're talking about is instead of taking millions of dollars worth of single-use disposable supplies and sending them straight to the garbage, to destruction after use, we're keeping those resources in the domestic supply chain. We're keeping it in our local economies. Circular economy solutions are job creators and they're local job creators. And so what we're doing is using the clinical supply chain to support the economic and the social causes of health, something that we should all be taking a look at as a sector. So this brings up our first panelist. And one of the folks that I know that speaks the most clearly of processing not only as a circular economy solution, but as an economic engine that lowers the cost of care and really builds economic well-being domestically. I am pleased to introduce Dan Vukolich. Uh, Dan has been with the Association of Medical Device Reprocessors since 2000, representing companies that conduct the majority of commercial single-use medical device reprocessing and remanufacturing being done in North America and Europe today. Dan joined the AMDR in the same year that the FDA issued requirements putting reprocessors on an equal regulatory footing with medical device manufacturers. With over 20 years of experience working on medical device reprocessing issues and representing the industry before state regulatory agencies and international bodies, Dan is intimately familiar with the industry's legal, regulatory, public relations, and political landscape. Dan, it's a pleasure to have you here today.
Thank you very much. I appreciate the introduction. And Erica, to your point on the subject matter of our reliance on single-use or disposable devices, I've been doing a lot of research, as you can imagine, given all of this uncertainty surrounding the supply chain. About 70%, at least, of the devices that we're reprocessing are made in China. And then because the manufacturer puts a single-use label on it, most of it ends up in the garbage. And so we're, as I heard one commentator say, we're exporting US jobs and importing garbage, which is not good public policy. And so the shortages that took hold during COVID, and now with the threat of tariffs or supply chain vulnerabilities, all the more reason to look at a circular solution because we need to keep these valuable resources here at home. So I appreciate the introduction. The only thing I'll add is I'm an attorney. My area of expertise is medical device law, medical device reprocessing regulations. We all have to have our niche, and that's mine. And I'm also from Minnesota, so I'm happy to see so many fellow Minnesotas on here. In the interest of saving some time, I usually give a minute and a half video, which is what is on that next slide. But I'm going to put in the chat a hyperlink. I want to keep it here to 10 to 12 minutes so that there's time for discussion. But this is a piece of art, really, that a Dutch woman put together to demonstrate the amount of waste associated with just one surgery. And she quite eloquently does it. So perhaps after this call, if you have a minute and a half before you go on to your next meeting, you can take a look at it. Looking at the next slide, as we were discussing at the beginning of the call, not only are we reprocessing devices, 70% of which are coming from China, a majority of which are coming from a global marketplace where there's different places for assembly, labeling, sterilization, warehousing, but 80% of healthcare's footprint is associated with scope 3, or all this single use or disposable stuff which contributes to it. And this data is sort of mirroring similar data we're seeing out of the UK, which estimates about 72%. So in addition to saving money and reducing waste, we can reduce emissions if we reduce our consumption of a lot of these single-use devices. I think when I started this job 25 years ago and the reprocessing industry was new, I was interested in it as a young man because I knew that healthcare was wasteful. I wasn't in healthcare, but my grandmother was, she enlisted in World War II in the Army and she was trained as a surgical nurse, but she was also of the Depression era. So nothing went to waste. And we would call that sustainable now, but she didn't call that sustainable. That was just being smart. And so she brought home from the hospital all those open but unused drapes, gowns, surgical instruments. My bath toys were irrigation syringes, which seems sort of funny in retrospect. But when this young trade association was looking for a young professional to run their new business, I was really found it appealing because this was an opportunity to reduce waste. Never would I have used the word circular economy. That's only something I've learned since COVID, but we are perhaps the best example of a circular economy solution for healthcare products that I know of. And in short, circular meaning, please don't put the spent medical device in the trash. Put it in the bin for your reprocessors to collect so that we can remanufacture it into a new device using used components that will be as clean, as sterile, and as functional as the original device. And by doing that, you can reduce your cost. We're reducing waste, we're reducing emissions, and at times of supply chain vulnerability, we're reducing the vulnerability of being short on supply. Our model is circular in the way that we return the products to the hospital and we have reverse logistics in collecting them. But reprocessing is the word we use in the United States. Remanufacturing is a word that is more likely taken up by international regulatory authorities. We do all the same sort of reprocessing steps you would also see in a hospital: disinfection, cleaning, packaging, sterilization. But we're doing it on an industrial level, and we're doing it to medical device manufacturer specifications and requirements. So the SUD reprocessor, the single-use device reprocessor, must be held to the same standard as if the device was brand new, and the reprocessor becomes the legal responsibility for that product. Very briefly, these are the types of devices that we're reprocessing. This represents the breadth of our product offerings. And if any of this interests you, you can find all of this information also at amdr.org. And these are some of our top line figures. We're saving US hospitals almost $500 million now, but we're beginning to quantify the pounds reduced and the equivalent in emissions, given we're giving better and better data year over year from the members. This is also on amdr.org if you're interested in some of these stats. So why would you reuse a device that was labeled by the manufacturers for single use? I have some show and tell. This, many of you may be familiar with, is an ultrasonic scalpel, and it sells for $450. How did we get to the point where we're throwing away $450 scalpels or $2,500 cardiac catheters? It's absurd. The reason devices carry a single-use label are not because FDA requires it. It's because the manufacturer chose to use that label. And so when we reprocessors come to the table and show FDA the data with our cleaning validations, we're standing in the shoes of the OEM and completing the cleaning validation that the OEM or the original equipment manufacturer elected not to conduct. And after all, they make more money the more devices they sell, and so their incentive is to create more devices, not more life in the device. And so the reprocessors are there in our alignment with hospitals to take advantage of that inefficiency and that wastefulness. And this has been confirmed by the Wall Street Journal. So we began FDA regulation of SUD reprocessing in 2000. 8 years later, the US Government Accountability Office issued this report on the right because a lot of manufacturers didn't think these reprocessors were really turning out devices that were as safe and as effective. And in fact, the GAO reported that they don't have any data indicating any increased risk to patients from FDA regulated reprocessed devices. There is a website, and I know sometimes there are still naysayers. And so if you want a resource for that one stodgy clinician who doesn't want to use reprocessed devices, rather than relying on me or industry, you can get it from the horse's mouth. FDA has very clear guidance on their website, and it's at this link, and we have a link on our homepage that explains the regulatory role they have in overseeing reprocessing and the assurance that they have that these products are safe and effective. And so our safety principles beyond meeting medical device manufacturer requirements are that we test or inspect 100% of the devices that we reprocess. An original manufacturer will give you back a sampling. We test or inspect everything. We trace or track everything on the device. I don't know if you can see it, but we'll have tracing barcodes or some way to track it. And obviously, we can only reprocess those things for which we have a cleaning and sterilization validation demonstrating the product is safe and effective. Okay, so this is big news. I'll spend maybe a couple of minutes on this because I know a lot of people are talking. One of AMDR members' reprocessors, Innovative Health, a company with a specialty in cardiac catheters, beat Johnson & Johnson back in May in an antitrust lawsuit. In short, we're going to see an injunction as soon as next week. And I will put on amdr.org, there's a blinking button, what that injunction means for hospitals. But it appears the judge is going to enjoin or prohibit Johnson & Johnson's Biosense Webster from tying the case support in their cardiology procedures with buying only Biosense Webster product. We also believe that the injunction will bar Biosense Webster from putting microchips in the handles of devices to make them obsolete. A third issue that was addressed in the case that we don't know if it'll be in the injunction or not has to do with hoarding. Johnson & Johnson does operate a reprocessor, SterilMed, that is not an AMDR member, and Biosense Webster was using SterilMed to hoard spent cardiac catheters to prevent them from going to other reprocessors, even cardiac catheters that neither SterilMed or Biosense Webster reprocess. So this has been big news, and more details will be coming out. But this is a strong, powerful tool for hospitals now to push back against those types of behaviors, against not just J&J, but any OEM. And so we'll put resources on the AMDR webpage on how that might be constructively put to use for you. So these are sort of what we call our seven deadly sins. In addition to the three things I mentioned, there's a lot of software gimmicks going on where sales reps will come in and update the software on console or generators with some stated reason that it needs an update. But what it's really intended to do is to stop the devices from working with certain older models of the handheld equipment so that basically it would phase out reprocessed devices. We've alerted FDA to this. We think this is a patient safety issue. You should not be making changes to generators that would impede their ability to work with devices on hospital shelves. And then other things that we urge hospitals are in this list when you're contracting with medical device makers. Okay, made in the USA. When we reprocess it, I did, as I mentioned, about 70% of the devices that we're looking at are coming from China, or excuse me, reprocessing, and we're able to mitigate against that by reprocessing here domestically at home. And the price is 30 to 50% less. Obviously, the cardiology is the area where hospitals can inure the greatest savings in terms of dollars, but in terms of potential emissions or waste reduction, it's non-invasive devices like this pulse oximeter or this compression sleeve. And then in the last few slides here, we've conducted a number of life cycle assessments, the ISO compliant 14040, to look at between 13 and 16 different environmental measures. We've commissioned 8 so far as an industry, and every one is coming back with between a 30 and 60% reduction in carbon associated with reprocessing versus buying new and throwing it away. On most environmental measures, we do better, but it underscores with academic and scientific near certainty that it is preferable from an environmental standpoint to reprocess than to throw things away after one use. And this is a summary there. This information is available on the AMDR website. And if, Erica, you go to the next slide, you'll see our calculator that's built on the data in the previous slide. There are a number of hospitals seeking to get the Joint Commission's sustainability certification, and you have to benchmark your emissions. And so if you want to easily, credibly quantify what you're doing to reduce your scope 3 emissions, you can use our calculator, which is based on 8 peer-reviewed life cycle assessments to come to the data points that they do in carbon reduction. And the calculator will also allow you to plug in using EPA data, what the equivalence would be in less consumption in other variables to make it interesting for sort of marketing purposes and what your hospitals are doing. And I think that's it for me. These are the AMDR member companies. As I mentioned in the point of the litigation, membership in AMDR now I think is more important than ever. As I said, we have a code of conduct to which we adhere. And so we urge we urge hospitals to do business with an AMDR member reprocessor.
Thanks so much, Dan. This was really a great presentation. I encourage folks to visit the AMDR website. It's definitely a wealth of information, really resources to easily make the case for reprocessing in the whole of economy, but specifically applied to your healthcare system as well. I think I definitely, there's been instances in the last few years of when we have these supply device shortages in the OR, we're talking about considering whether or not to cancel, surgeries, and you can't find the parts for the supplies when we're out. And so I think it's really important that these cases are going forward so that, again, we really have a whole of economy approach to maintaining our supplies. Excellent. Well, not only are there circular economies at the industry solution available, really creating success for these initiatives starts by implementing common sense solutions in the clinical setting. And to talk to us today about how resource conservation is both possible and a net benefit to quality and efficiency in the surgical environment is Dr. Paige Fox. I am so pleased to introduce Dr. Fox, who is a board certified plastic surgeon who specializes in hand surgery, reconstructive microsurgery, including facial reanimation, as well as peripheral nerve and brachial plexus surgery. As as a physician and surgeon, she's an associate professor in the Division of Plastic and Reconstructive Surgery. Her lab focuses on wound healing and nerve compression, and she conducts clinical research on optimizing care delivery of upper extremity and nerve disorders, both in the US and around the world. Dr. Fox also has a passion for sustainability and healthcare's effect on the environment. Dr. Fox has been instrumental in clinical improvements, leadership, mentorship, and innovation to green the OR and clinics at Stanford Medicine. Welcome, Dr. Fox.
Thank you, Erica. And thank you, Dan. I learned a ton from your presentation. I always feel like, sometimes coming to these presentations is just as educational for the presenters to hear, what each of us are doing. So thank you for the invitation to be here. I'm going to really talk about two things today. I'm going to talk about, I'm going to stick in the OR today, and I'm going to talk about pack optimization and then preference card optimization. So starting out with packs. Really, when I started my journey in sustainability, I really wanted to start with reusable gowns. And I always tell this story because I think it's important that I wanted to start with reusable gowns. And that was really in late 2019. And a few months later, I think everyone knows what happens. And really, nobody wanted to talk to me about reusable gowns. And so I always think for sustainable solutions, it's not never when someone says no, it's just not right now. And so I said, what do I have direct control over? And I said, I have direct control over the trash in my own operating room. So we started looking at our pack. And for those of you that don't know, on the next slide, I just have a picture here of the things we're able to remove from a pack. So a pack is really what comes into the operating room. All the supplies are together. These are single-use items, but they all come together, so they're not individually packaged. So everything that gets opened in the pack is now non-sterile and should not be reused. And so we looked at our pack for high volume procedures that were of low complexity. And we said, we have everything that we use for a very complex surgery in the same pack for a non-complex surgery. We said we can create a minor pack for these really short procedures. And when I say really short procedures, I mean these are 10 to 15-minute procedures. And between myself and my colleagues, we're doing hundreds of them a year. And so we took out tons of items here. And you can really see who needs a 5,000 cc basin for an incision that's 1 centimeter long. I can't put 5,000 cc's of fluid through there even if I wanted to. And how wasteful is that? So lots of things we were able to take out. And then I also have my colleagues down here. And the reason I have them down here is really because when I said, oh, I'd really like to create a hand minor pack, do you mind? Everyone was like, oh my gosh, why haven't we done that before? That's such a great idea. And it really, I think surgeons, well, we have a bad reputation for being kind of mean or really, rigid in our thinking and my way or the highway. And it was easy. They just said, oh, why haven't we done that? Yeah, if you want to do it, great, thanks. And so on the next page here, you can see what happens when we get down to that minor pack. So the tray that the minor pack comes on is a compostable tray. We have just a couple blue towels, which hopefully I hope to get rid of someday. We have light handle covers, a single syringe, and a single drape. And really, really able to get this pack down. And if you do a comparison, which we do on the next slide here, of what we had before and what we had after, on the left, really that standard setup. This is the standard hand setup for any hand surgery. And you can see there's just tons of things on here that are going to be thrown away and aren't going to be used. And there's also a lot of instruments on here. I'm not getting into instruments today, but decreasing instrument reprocessing affects energy use and water use. So two different things than we're talking about today. Today, we're really talking about waste and those scope 3 emissions. But if you can cut your instruments, which are shown here on the left in a large a rectangular tray, down to what's shown here on the right, which is more of a square tray. You can actually process 2 of those square trays at the exact same for the same energy and water as one of those larger trays. It also saves money and time because it takes about 15 less minutes to for one of our supply chain team, excuse me, for one of our instrument team to clean and prep one tray versus another. So you save about 15 minutes of time. So you can see we went from this standard pack down to this minor pack, and that we were able to save $70 per case, plus the waste diversion. I don't even talk about how much it costs for us to throw these things away, especially if they end up in biohazard trash. And we were doing greater than 10 cases per week. So really, we will go from this and then down to what is on the next slide here, which is really our new state. We took away the gowns. We took away a huge drape that draped the patient from their head to their toes. We took away everything but gloves and a sterile drape. And really, we were excited about this change, and that led us really to keep working on changes. On the next slide here, that's what made me really interested in getting involved at a higher level. So I was involved just with myself and my team trying to make changes, but I was really fortunate to get the support of Stanford Healthcare and the Sustainability Program Office to become a medical director of sustainability. And what that meant was I could get some more resources and connections behind me. And Erica was a person who worked with me on several projects that I did alone and then did in the Sustainable Program Office. And what the program office has really offered is on the next slide there, is just some guiding principles that are commitment to sustainable healthcare throughout the sustainable affirmation statement and integrated strategic plan, and then each yearly plan. And then on the next slide here, we have our 5 pillars. And this is what guides us when we think about any one of the projects that we're doing. And I think that's really important when you start a project at your hospital, at your healthcare system, is you say, which of these things am I changing and how am I going to be changing them? These are the obvious ones if you're into sustainability: greenhouse gas emissions, energy, waste, water, and chemicals of concern. And your project may hit just one of these, or it may hit multiple of these. And that really gives your hospital system a chance to say, how are we really, to Dan's point about getting that TJC certification for sustainability, or your practice green health, which one of these pillars are we affecting? So then we went on to a slightly bigger project, and this is looking at preference card optimization. So for anybody who does not know, a preference card is what comes up to the operating room and tells the circulating nurse and the scrub tech what to open for every surgeon for every case, what to have available. And this is a hugely important that these are accurate for a number of different reasons. One, there's case delays. If you need something for a case and it doesn't come, supply chain is not next to the operating room for most people. It doesn't come up. You may have 30, 45 minutes, depending on the distance and the size of your hospital and how specialized what you're looking for is. You're going to have case delays if you don't have it on there. You are going to have a significant amount of waste if you're opening items that don't need to be opened. And with that waste comes cost. And so with all these things in mind, we said, let's try to optimize the preference cards. And instead of what the usual pattern is, which is asking the circulating nurse or scrub tech to optimize the card, let's ask the surgeon, the actual person using the devices, to be involved in this. And so what we did is shown here. We knew that 30% of waste in the hospital comes from the operating room. We know this is important for us as surgeons to be responsible for this. Dan mentioned a lot of strategies for thinking about those single-use devices and how to reprocess those. And I'm really talking about these single-use items beyond that: extra gloves, extra gowns, extra syringes, extra dressings that you may not use. And so this is a standard preference card on the left. And what we did was we wanted to look at this with a pilot group of surgeons. So shown on the next slide here is who we engaged. And this is really talks about how everybody who works in the operating room, in supply chain, in data analytics, everyone has a role here. Our key collaborators listed there in green, and the Sustainability Program Office really helped oversee this project. And myself and a couple of my colleagues, Drs. Wu and Tsai, helped get this project going. And then we had 20 pilot surgeons. And the outcomes are here. Our process is on the next slide. So what we did here was we asked each of these 20 surgeons, so they wouldn't be uh, overwhelmed by the amount of work. We said, can you just look at your top 3 to 5 cards and edit them? And we sat down with them one-on-one meetings. And then we looked at our other hospital systems. We collected their feedback. And then our goal is to eventually scale this across our entire enterprise. Our outcomes from those 20 surgeons are shown here. And in 1 year, we had 14 of our 20 surgeons update their cards. They updated 41 cards that affected 866 cases with an annual cost savings of about $200,000 and an estimated cost savings per case of 229. And what I'll tell you is we really gave surgeons the opportunity to add things to their card, take things away, and we really didn't drive this and say, you have to take things off your card. We said, we want your card to accurately represent what you do. And it really was that most people were like, I never use this. I never use this. Why is this even on my card? And I'll tell you, two surgeons on here had an item that they was getting opened every single time they did a case that was $800 and they never used it. And they'd been working at the hospital for greater than 5 years, and they had a totally inaccurate preference card. And this just speaks to the amount of waste that exists in healthcare. And so if it exists in my hospital, I promise it exists at your hospital. And so really our goal with this is to just continue doing this, continue rolling this out. And then there's also automated ways to do this. And then we're working on that as our next steps. I want to give out one example of a reusable option. So, Dan talked about reprocessing. This is reusable versus reprocessing. And I know there's some confusion with that term, and that's why in Europe they use remanufacturing. But a reusable option is really the thing that can be washed downstairs in your own hospital. So a LigaClip there is shown on the left. That's a single-use device, has about 20 clips inside of it. And for biopsies, our breast surgeons were using 4 of the clips of the 20 and then throwing it in the trash can. And that single-use plastic just went in the trash. And the breast surgery team said, hey, you know what? We use 4 clips. Every one of these little houses has about 5 clips on it. Some have 6, but most of them have 5. And so we can just use that, and we can use this clip applier that we can use hundreds and hundreds of times and wash in our own washer downstairs. And putting one extra instrument on a tray that in no way changes water or energy use. And they saved almost $100,000 just with this single change. So I think the impact can be big when we think about each of our surgeries. I would be remiss not to thank all the people involved in these projects. This is not the pilot surgeons, but this is really all the people that I've gotten to work with across the hospital on lots of these projects. And you see people here from program managers to surgeons to PM&R physicians, orthopods. So just really everyone has a hand in sustainability in healthcare. And I just want to drive that home today. So please feel free to reach out if you have any questions. And I know Erica's going to lead us through some questions coming up.
Thanks so much, Paige. That was really excellent. And just pointing out again that engagement is really at the heart of all of this. And there are good ways to engage your surgeons, your frontline staff, really getting those folks involved. So that's one of the things that we'll tee up here for our conversation. So I just want to take a minute and have a quick moderated panel here with both of you today and just talk through a few questions of how do we make the case for reprocessing, for circular economy solutions? These are common sense solutions, but of course the challenges of getting them implemented one institution at a time are real, right? And so just helping out the folks that are on the call today, kind of the first question, Paige, expanding on what you said about getting surgeons on board, there still is, and it's not always like a surgeon in the OR, but there still is this fact of the matter that healthcare is very smart, very self-starting, autonomous clinical leaders. And so how do you navigate really helping to create these system-wide improvements while maintaining the right of folks to choose what device or supply to use in a patient care setting?
Yeah, I think Thank you for your question. I think that the most important thing is really not to push people in one direction or the other, but really talk to them. You know, your surgeons, your physicians, they are smart people. They didn't get there by accident. And so really talk to them and provide them with the information. And that's what I loved about what some of the things that Daniel showed, is that we really need to give people all the information and lead them to the decision themselves. They may make what we feel like is the right decision or what we feel like is the wrong decision, but we're leading them to the decision themselves. And with that, I think a lot of people make that sustainable solution. They'll say, oh, I didn't realize they had the same regulations as the FDA. I thought this was just somebody, you know, washing them off downstairs, and they don't even know what's happening. Where are these devices coming from? So I think providing them with that information is so important. Many people love the data, they just love the numbers. And so that's where I'd start. I'd start by giving them the information and allowing them to make the decision. The second thing I would say is having a champion really helps. So if you have someone who's willing to stick their neck out and say, hey, you know what? I will try 20 reprocessed devices. I will then come back to all of you and tell you what I think of them. And then if you want to get on board, you can get on board. And that's great because then there's sort of someone who's willing to take the brunt of the test. People don't want variability, unanticipated variability in their case. And that's why sometimes they're unwilling to change. It's really their heart's in the right place when they have that. And that's why Dan's example of updating the software is so concerning. When we walk in and that instrument we've used 100 times doesn't work, where anxiety goes up.
Yeah, for
Definitely.
sure.
Yeah. The one thing that I did want to point out from the presentation page is just counting those savings, like counting that, first of all, every time that there is a fear of, will this increase the amount of time? And when you're really focusing on throughput in the OR, time is clinical outcomes, it is organization, it's quality, it's patient care. And so you know, a net increase in the time that it takes to turn over a room or extra demands on operational staff, there is a hesitance to add new tasks in the clinical space. I think it's really important to count the minutes that it takes to do a new task and really compare it with a baseline. But I do think that much as you showed, counting those operational savings as well is really important because you do have to point out where there are operational efficiencies in house so that we're changing kind of that expectation that sustainability is going to be more work. So I think that's just an important note as well.
I've got a
Yeah,
client that says, yes, sustainability might be a little more work, but it's worth it. In the long run, it's going to save you money. It's going to save you time. It's going to reduce your dependence on the supply chain. It's going to reduce your waste. It's going to reduce your emissions. So in the long run.
absolutely. So Dan, kind of talking through that, you know, reprocessing is it should be a no-brainer from a cost, from an environmental, from a resilience standpoint. And a lot of the work that you do is really looking at and addressing those big structural barriers that still
Yeah.
exist, right, to reprocessing implementation. And so,
Yeah.
would you like to share with us what are those big barriers? Like, how do we characterize them? And how should folks that are inside of the healthcare setting really think about navigating those challenges?
Yeah, well, to echo what Paige had said, in response to the last question, it's all the same things. It's the biggest challenge is maintaining the program, making sure it doesn't fall off the rails, making sure that you're constantly educating the teams and that the right devices are being put in the right bins. And I know it's a lot of work, but when we're making the argument, Edgar asked in the chat about, what's the pitch to the C-suite? We have systems that are saving $1 million a year. What could you do with $1 million? Just reprocessing their own stuff. So the second challenge we have is what I addressed in the court case, which is continued manufacturer resistance. But for the reasons I outlined, I think the future looks better for us in that. I'm hoping it's a call to action for the larger manufacturers to work with us rather than against us. Let's make products, if we don't think we can make them to be reusable in the healthcare facility because either it's too intricate or something, then let's make a deal with these commercial reprocessors, manufacturers that make this great equipment, and we have expert, reverse engineering, reverse logistics to be able to extend the life of these products. So I will put it in those two buckets.
That's great. Kind of expanding on that, we're in this environment where we're kind of stuck having this back and forth of, how do we make the case? How do we create is it possible to reprocess what we have in house? Kind of at the top of that reverse triangle is redesign. And I really
Yeah.
think about like, what do you think is possible? And do you get glimpses of it from your vantage point of, are there medical device manufacturers that are thinking about how do we design for reprocessing from the get-go so that we maximize the value of those materials?
Yeah, well, the problem right now is the economic incentive is not to be green because the manufacturers sell per unit.
Yeah.
I think, and not to get, philosophical here, but thinking of other businesses, like in the jet engine business, GE and Rolls-Royce don't sell jet engines anymore. They sell engine hours. And so the incentive has changed. The jet commercial airlines wanted an engine that was more fuel efficient, that broke down less, that was easily interchangeable. So those are the types of things we should want in healthcare. And so I think we need to change the dynamic. And so by rewarding companies with a circular business solution, it's going to drive other companies to make more circular business solutions. And so that's my pitch. And start with reprocessing.
Awesome. Awesome. Thinking about how these solutions get implemented in the healthcare sector, one thing that we see inside of the hospitals, and something that you displayed quite well on the presentation page, is just that good things happen when you make the possibility for the clinical supply chain to collaborate with clinicians, really putting together the folks that are supplying with sustainability subject matter experts, with the folks that are using these devices at the point of care. It gets really tricky though in the healthcare sector. Everyone's busy. Nobody has time for extra meetings. How have you, like, where have you found kind of the best examples of where this collaboration works well? And then also, like, where do you see opportunities? Like, what do you think the healthcare sector needs in order to create more space like this so that we can continue to build these solutions?
I think this is one of the hardest questions we have to answer. Everybody has external pressures. To Dan's point, the external pressure of the supply chain is always having a resilient supply, everything ready all the time. They're not necessarily ready to bring in a new supply that they don't know about. That's extra work for them. And so it is really in these shared incentives is where you can get the collaboration. So one example of something that we're doing in coordination with the supply chain team is they want to update the names on the preference cards. Well, surgeons need the names to be updated because we don't know what product 1623 is. And so then if we say, okay, I'm going to put in a little of my effort to do this, you're going to put in a little of your effort to do this, and then we're both going to achieve our goal at the top. I think that's really important. And so it's aligning those goals. And then it's really involving all the stakeholders because I think we are probably working in silos towards shared goals and we don't know it. And I've seen this before, several times before. Somebody wants to get reprocessing on the docket, and somebody else says, "Well, we don't have any surgeons that want to do reprocessing." And meanwhile, I have surgeons knocking on my door saying, "I want to do reprocessing." And so we're doing siloed work, supply chain and sustainability. And if we talk to each other, we'd be able to connect those dots. And so it is having some leadership in this. And that's, why I mentioned about the sustainability program office at Stanford, because one of the things that having project managers that's helpful is they find out who all the people are that need to be at that meeting, and then they can set that meeting around my schedule because you're right, I'm not that flexible. And so I think that is really an opportunity. um, it's possible, you're right, it's hard, but good things are hard, and that's why we got to work at this.
Excellent. One more question, Dan, and then we'll open it up to, I see we have some great questions from the participants here. Um, Kind of going back to making the case, from a safety and quality standpoint, I think you presented quite eloquently on this, that this is remanufacturing, that this is held to the same standard. Are there any kind of special messages like when individual health systems are coming to you, which is like, how do we make the safety and quality case for this inside of my institution? What are the pieces of advice that you give folks?
Yeah, in fact, we're going to create an AMDR, a new sort of resource or one pager on this that summarizes the data. I take it for granted. I do this all day. And so I need to make sure that the clinicians who are proponents of this have the resources because they don't have time to research all of this. But it's not just FDA regulation that has confirmed that these products are safe and effective. We now have 25 years of peer-reviewed literature. We have 25 years of adverse event data. We have 25 years of clinical experience. And so we know that the quality is there. I think I, at my association, can do a better job summarizing it, and so that's why we'll work on putting together that paper. We do obviously have this information on the website right now, but we can make it a little more concise.
And kind of putting that together with what Paige is talking about, it's so easy for folks to get siloed. I mean, every person who's working towards their quality,
Yeah.
cost containment, supply chain outcomes is pretty busy doing what they do every day. And so really helping to spread that message internally, from an industry standpoint, but also among our internal stakeholders. The message sounds different when, frontline nurses know the difference between single-use disposable and reprocessed. The same as an example that Paige gave, just simply engaging the surgeons on her team really gets immediate buy-in. So it's how do we really spread that message throughout the systems themselves?
I just want to make one more comment, Erica, because you said it, and I think it's so important, which is the education on the terminology and things like that, which is the other person that we have to keep up with all of this is our infectious disease colleagues. Because at many hospitals, they're controlling or contributing to a lot of these decisions. And so educating them on this data that you have, Dan, because again, they don't have time to do that primary literature review, is so helpful because they just want to keep the patient safe. That's really their job. And so that's someone I think that we don't always think about when we think about the supply chain, the user, and the hospital system. But we also got to keep our infectious disease colleagues in the loop too.
With that in mind, one question that is from our participants, Terry DeFina asks, should we consider adopting remanufacturing? It sounds like that's the term that's used in the EU. Is that something that the US should do just to clear up this confusion about, third-party reprocess versus internal reprocess, et cetera?
Yeah, right. Because when we say reprocess, we generally mean what's happening in the basement of the hospitals. Oh, but you can also reprocess single-use devices, if you meet FDA's requirements. I wish, unfortunately, 25 years ago when the law was passed and the regulations went into place, FDA took up the term SUD reprocessor. But more than that, FDA's definition of remanufacture doesn't match the rest of the world's definition of remanufacture. And there's an international medical device regulatory forum and various other harmonization groups that seek to make regulations same across countries. And they're all furious with FDA, but their FDA is not budging. So unfortunately, we're going to be reprocessors here in the US and we're going to be remanufacturers everywhere else.
Excellent. So it sounds like it's a great idea, but more difficult from a structural level. I think, Paige, I think the word remanufacturing is being used internally. Is that right? Is that how folks are describing it as well? Yeah.
Yeah, I think I really try to start all my conversations with people, discussing what we're talking about, which sounds a little bit funny because I actually think many people think reusable and reprocessable or remanufacture are all the same kind of bucket, and they're really very different, right? Your uh, knife handle is reusable and is just getting washed downstairs. Reprocessing and remanufacturing are the things that are leaving the hospital. And so just trying to distinguish between those two. Um, and then Dan had a slide that showed 3 columns, cardiovascular, and maybe you can help me here, the types of
Surgical,
devices.
yeah,
Yes,
surgical, cardiovascular, and patient care.
exactly. And, we have been thinking about them internally, at least, as invasive and non-invasive. Because I think for our infectious disease colleagues, that is a big difference. And so that's how we've divided it. And so just a different way of thinking about that, because there's probably different risks as we think about, your SCD or your pulse ox versus your catheter.
Excellent. I think that we spoke to Edgard's question, but just want to note it here, what's the business case for C-suite? And I think just expanding on that again, our executives are also siloed. And
Yeah.
when you're tasked with making very important decisions quickly, what do you want to know is like, what is the sure thing? What supports quality? What decision can I say yes to that I don't have to worry about at 2 a.m.? And so
Yeah.
reprocessing is a quality and safety solution. So
Yeah.
are there any specific messaging to mention or resources to note when you're making the case to your C-suite inside of the hospital?
Yeah, I think, beyond cost savings, which should be the no-brainer, especially if institutions can save, $1 million each. There's supply chain resilience. I mean, how will the C-suite look their doctors in the face if there's a shortage because of these tariffs or trade wars or whatever else for the device they need for their patients? And they didn't take advantage of the solution of FDA regulated reprocessing. And then also, and this is something that Paige is sort of speaking to when we want to speak to others, which is the nice thing I'm hearing is that young people want to be employed in health institutions that are focused on sustainability. And our patient populations, when they're not in immediate need of medical care, they want their hospitals to be sustainable. So it's good business if we want to attract the best talent and we want to be responsive to the communities of patients that we serve. So I think it's cost savings, supply resilience, and being green and being able to attract and retain the best clients and the best staff.
Just one thought to add to that is also talking about these things. To your point, patients want to be cared for at sustainable hospitals. And so it is part of the PR for a hospital to really highlight these efforts within their hospital. And I think that's good business too.
Yeah, and it
Excellent.
makes taking this, if you save $250,000 on compression sleeves, making sure that you retain or hire a new nurse. I mean, this is what local communities want, right? This is what our hospitals want. We don't want that money going out the door to some big medical device company. We want the money staying within the hospitals.
Yeah, I think that's right. And I think that's one message that can be made to the C-suite now is that these circular economy solutions are part of that sure thing. They are part of the decisions that help an executives, worry about one less thing at 2 a.m. And so, um, as we wrap up here, I just want to flash on the screen kind of some big takeaways here and then share with folks how they can find us. So I want to thank both Dan and Paige. From current slide. I want to thank Dan and Paige for joining us today and for sharing their wisdom and best practices. Again, just some takeaways is that reprocessing is a no-brainer. It's low-hanging fruit. And that while those structural challenges to reprocessing still exist, that there are resources such as the AMDR that can really help you find the facts that your smart clinicians want to make good decisions and to help make the case and build reprocessing in your institutions. Again, Paige notes that everybody is on to team sustainability. And we thank you, Paige, for really giving us some practical examples of how best to engage busy, smart people in creating these solutions together. Again, that alignment is possible and that sustainability is quality. Where can you find us? Again, please reach out, visit ksh.com, find us on LinkedIn as well. Follow our newsletter. Please sign up below. We would love to stay in touch. We also are in the business of making friends, so please follow up with us and let us know what we can share in the future webinars. Likewise, here's where you can find Dan and Paige. Again, two of the smartest folks I know on the circular economy and healthcare. And so it has been such a pleasure to have you both here today chatting. So thank you so much for your time. Thank you to everyone who's joined. And everyone take care, and we'll see you again. Thanks so much.